I wanted to ask Dr. Gupta, can these AI tools actually prescribe medication to any client or customers or any users, actually, as you call them for your apps? Um, because a lot of these.
That's an unfair question to ask, Megha. No, they can't. Because there are guidelines who prescribes, who doesn't. And the only people who can prescribe medications are registered medical practitioners. Non medical practitioners cannot prescribe medications.
Yeah, but Garima, the way AI could help there, AI cannot prescribe medication. But in many use cases, AI is being used to just collect a patient's stats, physiological data, or whatever symptomatic data, and being able to triage the user, right? Being able to identify patterns and predict that, okay, this user might need to be seen by the doctor, right? So it can take away some of the burden of the clinician, but no, it cannot diagnose, cannot prescribe medication. Ultimately, there has to be a professional in the loop, human professional in the loop. AI can say, okay, this patient probably needs attention. Doctor, can you please look at this file, right? Look at this patient. They might need more attention than others. And then the doctor could probably prioritize their treatment. But ultimately, it has to be the human professional who has to do that.
And what about therapy? Can AI provide full-fledged therapy to
at this moment in time? This is again a question which is a difficult one to answer because therapy is not a generic umbrella, right? There are various kinds of therapies. So to say that can AI provide for therapy right now again is probably not the fairest of the questions, because we are now trying to enter a domain where we don't know is the answer right now. Right now, we have some evidence that AI is doing some contribution and we need to build on it, see where it takes us. And rather than trying to overachieve, we shouldn't lose out on what we are in a position to achieve. Please understand the importance of that.
And that would be to increase access.
Increase access, give basic intervention, which may be significant for a lot of people struggling with issues, and to be able to guide them to the earliest intervention to the next level. Even if that much we are able to achieve consistently for a period in time, I think we would have done a remarkable job. We don't need to jump 20, 30 steps here. This particular step needs to be consolidated before we want to do the next big thing.
Right.